Welcome to our assisted gowning and gloving video. Over the next few minutes, we'll provide insight into working in and around sterile fields during your surgical rotations. By following these simple steps, you will help us achieve our number one goal of keeping patients safe and preventing surgical site infections. Prior to scrubbing into a procedure, please provide your name and role to the circulating nurse in the operating room and ask the scrub personnel if they need a gown for you. Then head to the sink to complete your surgical scrub. After completing your scrub, back into the operating room with forearms tilted up, allowing any water to drip down and away from your scrubbed hands, and wait for the scrub person to assist you. Ask the scrub person for a sterile towel. Dry your first hand using only one half of the sterile towel. Dry from fingertips to the elbow, moving from clean to unclean, and never moving the towel back down your arm towards your fingertips. Keep both hands separated by the towel to prevent cross-contamination. After your first hand is dry, sweep your dry hand under the unused half of the towel and dry the opposite hand using the same method. Discard your towel in the soiled linen bin or hand the towel to an unscrubbed member of the surgical team. After you've performed a wet scrub, subsequent scrubs that day may be done with the waterless scrub option, Avogard Hand Antiseptic. When using the Avogard option, the wet scrub procedure we just discussed may be omitted. The scrub person will then present a gown to you. Put your arms down the sleeves without your hands protruding from the stockinette cuff of the gown, as it is unsterile. Keep your arms above your waist but below your shoulders to prevent contamination. The scrub person will then present the right hand glove to you. Keeping your left hand in the gown sleeve, pull the right sleeve of your gown to expose your right hand. Do not pull the cuff past the web of the thumb. Put your right hand in the glove. Resist the urge to adjust your gloves during the donning process. After the right glove is on, use that gloved hand to pull down the left sleeve to expose the left hand to the web of the thumb. Use your gloved hand to assist the scrub person in opening the glove, touching the outside of the glove only. Slide the left hand in the left glove. Now you may adjust your sleeves and gloves for the perfect fit. The scrub person will assist you in donning your second pair of gloves, and you may assist the scrub person in opening both gloves. After donning both pairs of gloves, you are ready to finish donning your gown. In the front of the gown, there is a card. Firmly hold the card in your right hand and remove the left, shorter string from the card. Hold the left string firmly in your left hand. Leave the right string threaded through the card opening. Hand the card to any surgical team member, scrubbed or unscrubbed. They will hold the card still while you spin counterclockwise. Take care not to come in contact with anything unsterile. Grasp the string still attached to the card and pull firmly to remove. Tie the ties together in front of your gown. Now that you are fully gowned and gloved, you may approach the sterile field. The sterile parameters of your surgical gown are as follows. From the chest or axillary line down to the OR table or sterile work surface. From 2 inches above the elbow down to the fingertips, your arms must always remain in front of you. The back of your gown is not considered sterile. If you need to reach up to adjust a surgical light, watch your hand and arm as they raise above your head so that you can avoid contamination. In the room, you may only touch sterile items. Items considered sterile are the tabletops and the instruments on the tabletops. Do not reach below the table edge. If instruments or supplies are dropped, let them fall. They can be replaced. When it is time to scrub out or doff your sterile surgical attire, back away from the sterile field. With your gloves still on, use your left thumb to break the outside tie at your waist. Grasp both sides of your gown at the hip and pull forward. Shrug your shoulders and pull the gown downward, disconnecting the Velcro fastened at the back of the neck. Pull your arms out of the sleeves, leaving your hands in your gloves. Roll your gown so that the contaminated outer surface is turned inward and discard in the appropriate receptacle. Now you can remove your soiled gloves using the glove-to-glove and skin-to-skin technique. And lastly, make sure to perform hand hygiene after removing your gown and gloves. This concludes Upstate's assisted gowning and gloving procedure.